Hello, I'm Dr. Matt Capriotti. I'm an assistant professor of psychology at San Jose State University, a licensed psychologist, and co-organizer of this summer's Treating Tourette Together Summit. Lately, there's been a lot of conversation about what we mean when we talk about behavioral therapies for Tourette syndrome, such as comprehensive behavioral intervention for Tics, or CBIT for short. As someone who's seen so many of my patients benefit so greatly from behavioral therapies, I'm excited to hear such a vigorous conversation taking place about this topic. And as part of this conversation, I'd like to share my thoughts on some different ideas that I hear about behavioral therapy from parents, youth, and adults with Tourette syndrome. Sometimes when people hear that we recommend a behavioral treatment for tics, they think we're suggesting that Tourette syndrome is simply a behavior problem, rather than a neurological condition. This is not the case. Tourette syndrome is clearly a neurological condition, and tics are never done on purpose. The word behavioral in behavioral therapy, or CBIT, is instead intended to emphasize that these are skills-based treatment approaches. In other words, these are active learning experiences that help people develop strategies to manage tics when they want to. The approach is similar to how neurologists and other medical doctors recommend behavioral or skills-based interventions for other problems that are also clearly neurological or biological in nature, such as migraine headaches, diabetes, and hypertension. Indeed, decades of research shows that behavioral interventions are helpful in managing these medical problems. CBIT is a 10-week program in which a person works with a trained provider to develop individualized skills they can use to effectively manage their tics. We know from multiple large-scale, scientifically sound studies that CBIT is effective in teaching tic management skills, which in turn results in a decrease in tics and challenges related to tics for many, but not all individuals. We know that CBIT, when delivered properly, does not cause harmful side effects. Based on these scientific studies, the American Academy of Neurology recently recommended CBIT as the first line of treatment for people with Tourette syndrome. Medications and other therapies may also be appropriate for many people, and many people with Tourette syndrome may feel that pursuing no formal treatment at all is the best choice for them. Sometimes people also think that CBIT is mostly about giving people with Tourette syndrome the message that they must suppress their tics. In fact, in CBIT, we never tell a person that they must stop their tics. Instead, we work directly with children, adults, and families to develop collaborative and supportive approaches to tic management that do not cause shame, anxiety, or put stress on family relationships. We never recommend punishing a person for ticking or rewarding them for not ticking. The focus is always on empowering the person with Tourette syndrome to manage tics on their own terms, with parents and the provider acting as coaches, not as bosses and not as the tic police. In all of this, we know that CBIT is not a cure for Tourette syndrome, and it's not expected or intended to eliminate tics. Rather, our goal in CBIT is to teach strategies that allow people to have greater tools to manage tics on their own terms. For many people, participating in CBIT can be a very empowering experience. All of that said, we know that CBIT is far from perfect, and we know that, like any treatment for Tourette syndrome, CBIT doesn't work for everyone who tries it. We also realize that we have a long way to go in improving our efforts to provide accurate information about CBIT and in making CBIT available to people who want it. We believe that the best way to make these advances is to put the voices of people impacted by Tourette syndrome first and foremost. That's why we're hosting the Treating Tourette Together Summit, Saturday and Sunday, August 17th and 18th in Minneapolis, Minnesota. This 2-day event will bring together a total of 40 partners, including people with Tourette syndrome, healthcare providers, researchers, and other individuals to collaboratively develop an agenda for conducting the next generation of research on CBIT. As part of this process, we think it's critical to hear all opinions about CBIT, especially folks' thoughts on how CBIT in its current form falls short. So, whatever your thoughts on CBIT, we hope you'll join us on this journey. We can't do it without you. To let us hear your thoughts, please visit treatingtourettetogether.org. That's treatingtourettetogether.org, and complete our pre-summit survey. It takes less than 5 minutes. If you'd like to attend the summit yourself, you'll be able to let us know when you complete that survey, and we'll follow up with you from there. For more information on CBIT, you can visit tourette.org, where you can find informational resources about behavioral therapies in the resource library, a provider directory to find a CBIT provider near you, and other tools.